Hi, good afternoon, everyone, and welcome to the Contact Tracing and Tracking System webinar. Today, we are going to give you an overview of the contact tracing and tracking solution in Kentucky that has been built for COVID-19. This solution was built in Salesforce, and we're going to be talking about different Salesforce features you need to be aware of to be successful in the tool. We'll also be going through the disease investigator initial interview and follow-up flow, giving you step-by-step instructions to complete both the initial interview and follow-up. We'll also be talking about the supervisor role in the contact tracing and tracking system, as well as the executive role, and then we will wrap up the webinar. Just a heads up, as we go along the content, there will be a few knowledge checks included throughout that cover key topics. So please be sure to pay attention so that we can get those knowledge checks accounted for. Again, our webinar objectives this afternoon are to understand your role in day-to-day activities in the system, to navigate the contact tracing and tracking system, and understand different process flows. And throughout this webinar today, I'm going to be referring to the contact tracing and tracking system as CTT, the acronym. Okay, let's jump right in. First, we're going to give an overview of the CTT system. We want to make sure everybody understands the purpose of the system. We're going to outline the different user roles and responsibilities for everyone who will be using this system. And then we're going to review a few key terms to be aware of. It's important to know that some of the terms used in the system may be overlapping or may be used in different ways throughout the entire investigation. But today, for our purposes, the terminology that we are using is very specific to the CTT system itself. So the CTT system populates case data that has been brought over from the National Electronic Disease Surveillance System, also known as NEDS. So information on cases in CTT is populating from the NEDS system. The CTT system allows public health professionals like yourself to investigate and track both COVID-19 cases as well as any exposed contacts that have been identified. The CTT system is really significant. It limits community transmission of COVID-19 by helping find those linkages between cases and working to prevent further spread. A few things to know about how CTT and NEDS work together. One question that is often asked is, how often does case data transfer from NEDS to the CTT system? Currently, information from NEDS is sent to the CTT system roughly every 2 hours. And there are currently about 160 data elements that the CTT system does receive from NEDS. Another question that's asked frequently, does information entered in CTT transfer back to NEDS? Currently, the solution is not bidirectional, so that means that data entered in CTT does not feed back to NEDS at this time. However, the project team is looking into this as a potential future enhancement. So it is important to know that all case data originates from NEDS. And it's also important to know that dual entry should not be needed if the information does originate from NEDS. The third frequently asked question, should I create cases in CTT? So cases should never be created in CTT. Cases should be populated in NEDS And once they're populated in NEDs, they then transfer over to the CTT system. So if a case does need to be created, the case should be created in NEDs so that in roughly 2 hours, it can be transferred to CTT. And then from there, once the case is created in CTT, because it was originally created in NEDs and then transferred over to CTT, that is when public health officials can continue conducting investigations by initiating that initial interview in the CTT system. Again, CTT captures the key information on COVID-19 cases that have been transferred over from NEDs. Public health officials, disease investigators are going to be able to conduct initial interviews with cases, and as part of the initial interview, they're able to track and gather information on the exposed contacts. The system also allows for daily follow-ups for symptoms and needs during the quarantine period. So again, CTT is used to conduct disease investigations for COVID-19 cases and determine their contacts. This is known as the initial interview in CTT. The system's also used to monitor cases and contacts. And then allows public health officials to take action and stop the spread. Another note is that users must have Firefox or Chrome downloaded on their computer in order to use the CTT system. Key terminology used in the system is displayed on this screen. We're not going to go through all of this live. Please be aware that the slides for this webinar are available in PDF form on Train. But just to draw your attention to the top, throughout this webinar, we are defining case and patient as a person who has confirmed laboratory evidence for a COVID-19 diagnosis or who has an epidemiologic linkage to a confirmed COVID-19 case. And again, as mentioned at the beginning of the webinar, the terminology here and that we're using throughout is specifically for the CTT system only. So once you have an established user role and you're logged into CTT, this webinar is meant to help you navigate the system, understand terms within the system. Okay, let's take a look at the different user roles within CTT. Starting on the left, the first user role is the disease investigator role. Disease investigators are trained professionals that contact the person under investigation and conduct the initial interview to explain the need for isolation. They also collect information, including the exposed contacts, so anyone who may have been exposed to COVID-19. In CTT, a disease investigator's main responsibilities are to perform initial interviews in the system. They complete patient follow-ups daily in the system. They're able to adjust the patient's status in CTT as needed, and we'll show you when that is needed later in this webinar. And they are also responsible for providing patients with helpful instructions and information. Next, we have the contact tracer role. Contact tracers are trained professionals who notify and monitor contacts of their exposure. They should perform regular follow-up with contacts and monitor activities and help ensure the safe quarantine of contacts. Contact tracers' main responsibilities in the system are to collect information from contacts during an interview. They should provide information and instructions for quarantining. And they should also complete contact follow-up interviews in the system. Next, we have the supervisor role in CT. Supervisors are responsible for managing teams of disease investigators and or also contact tracers through dashboards and reporting in the system. Supervisors' main responsibilities are to manage teams of system users. They're responsible for completing follow-ups with escalated and or referred patients. And they're also responsible with completing follow-ups with escalated and or referred contacts. One thing to know about supervisors is they're able to do all the functions that the disease investigator and contact tracers do. A note on disease investigators can perform the responsibilities of contact tracers as well. Lastly, on the right, you'll see we have a role called executives. This is for leadership from the Department for Public Health. These are people who have access to statewide information, dashboards, reports, and analysis for reporting capabilities. This role exists in the system really for statewide reporting and analysis purposes. Okay, now we're going to show you how to log into the CTT system. So you'll see that users are able to access CTT by first going to Kentucky Online Gateway, which can be found by typing in https://cog.chfs.ky.gov. So type this again into your Chrome or Firefox browser. And once you do, you will land on this landing page titled Sign In. Users then will type their email address and password that they've created for the Kentucky Online Gateway, also known as COG. They type their email address and password and then click Sign In. One thing to note on the right, you'll notice that this screen says State Employee Sign In. This is meant for any user who has an @ky.gov email address. If the user is signing in with anything other than a ky.gov email address, then the user needs to click on this hyperlink over here on the right-hand corner. It says click here to select user account type. That way they're able to select a different sign-in screen option that's titled Citizen or Business Partner Sign-In Screen. But if the user is using a ky.gov email, they should remain on the State Employee Sign-In screen and sign in here. Upon clicking signing in, the user is navigated to the My Apps screen here in COG, and you'll see that you should click Launch on the contact tracing and tracking application. Once you click Launch, you're taken to the screen shown in the top left-hand corner. Given a warning sign, and you should click Yes, I agree. One thing to note, if you do accidentally click No, I do not agree, you'll get a pop-up message where you can return or continue. But if you do experience any errors as you're going along, it's likely because you hit No, I do not agree. And we would recommend just closing the browser and re-logging in, making sure you click Yes, I do agree. After clicking Yes, I agree, you receive a pop-up that says, do you want to print this agreement? You can click Yes if you would like to print the user agreement, or you can click No to proceed. Once you make a selection, you're taken to the screen we see on the top right-hand corner, where we're able to click continue. Once you click continue, you're taken to the multi-factor authentication screen. So here you'll need to type in the 6-digit security code from the registered VIP token on your computer and then click continue. One thing to note, if you do not have the multi-factor authentication set up on your computer, we do have a quick reference guide that shows you how to download this token on your computer. So please reference that quick reference guide. It is located in the resources tab on Train, and it will show you exactly how to get that VIP token. Once that 6-digit code is entered from the token and continue is clicked, the user is navigated to their CTT home screen. I do want to point out that the specific user roles that we went through, the disease investigator, the contact tracer, supervisor, and executive, they all have a specific home screen that are tailored to their specific system needs. So if your home screen looks a little bit different than this, that is expected. And one other thing to note is if you have been logged into CTT, but you're inactive for 30 minutes, the system will automatically log you out. But if you do log back in, you will start off right where you left off. First, quick knowledge check of the day today. In the contact tracing and tracking system, the patient is the person who A, has confirmed laboratory evidence for a COVID-19 diagnosis, B, has been exposed to a COVID-19 case, C, contacts the disease investigators, D, enters information in the contact tracing and tracking system. The answer is the patient is the person who has confirmed laboratory evidence for a COVID-19 diagnosis. Great job. Next, we want to go over the set help desk process flows. So these are 3 help desk escalation processes that are very important to keep in mind if you do have any questions while using the CTT system. First, at the top, you'll see for any technical questions or issues with either the Kentucky Online Gateway COG login process, or for that multi-factor authentication, that 6-digit code you have to type in as part of the COG process, you should contact the COG help desk. You can see we've listed the phone number, email address, and hours of operation for the COG help desk. Again, this is the best escalation process if you do have any issues with that initial login, before you're actually into the CTT system itself. Next, in the middle of the screen, if you have any technical questions or issues with the CTT system, so once you're actually logged into the system, you see that home screen and you're navigating and using the CTT system. If you experience any issues, you should contact the ESMB help desk. Again, we have the phone number and email address as well as the hours of operation for this help desk. And I do want to point out that this is only to help with system-specific errors and system assistance. Any questions regarding decisions on cases or contacts should be left up to the program. And that brings us to our last help desk process flow on the bottom of the screen. If you do have any questions related to policy or that are questions outside of the system related to the larger investigation process, you should contact the KDPH contact tracing program. And the head of this program, the coordinator, his name is Brendan Matthews, and we've listed the phone number as well as the email address that you can use to reach out. Again, this is for any program-related questions you may encounter as you're navigating the system. It's important to know that when you are reaching out to these help desks, it's really good if in the email you include CTT and a brief description of the issue in the subject line of the email, and then provide specific information on the issue you're experiencing in the body of the email. This really helps the help desks triage the issues as quickly as possible. Okay, now that we've gone over our overview of CTT, we're now going to look at very specific Salesforce key features. Again, CTT is built on a Salesforce platform, and Salesforce comes with quite a few features that are extremely helpful to be aware of as you're navigating through the system. First, I'm showing you a screenshot of our patient details page, also known as the case details page. And this is a page, we'll show you how to navigate to this page later on in the webinar, but this is going to be your place for all details related to a specific case in CTT. And you'll see over on the left-hand side of the screen, we have a section called the patient details section. This includes information that has been transferred from NEDS and also gathered during the initial interviews that are conducted during that initial interview in CTT. The Salesforce feature you need to be aware of is you can see that next to each field, such as the name and phone number, there is a small pencil icon. And if you click on this pencil icon, you're able to quickly make a change if anything needs to be quickly edited. I also want to draw your attention to this unassigned box that you see in the patient details section. You see a small checkbox. We'll go through this in a while, but when the user starts working on a patient in the system, they're going to click accept to assign the patient to themselves. If at any time they want to unassign the patient from themselves, all they need to do is check this unassign box, and that will allow other users to view the patient. So when you click accept, only you, the disease investigator, are able to see and work on a patient. But if you want to make it so that any disease investigator can see that patient, you can simply click this unassigned button. Moving over to the middle of the case details page, you can see there's a big section called actions and recommendations. And right now we're defaulted to the actions tab. This tab allows users to begin that initial case interview as well as initial case follow-ups. And you'll see it's located in the middle of the screen in a really large section for easy access as a disease investigator. You can now see in this screen, we have clicked over to the History tab within the Actions and Recommendations section. The History tab is going to detail all actions taken on the patient, such as when the initial interview was conducted. So good for historical purposes to be able to look back and see. Below that actions and recommendations section in the middle of the screen, the next section is the questionnaires section. And this will include records of all the interviews that are either in progress or completed for this specific patient. Below that, you can see a section called Patient Contact Settings. This section will include the records of all settings that have been identified during the initial interview. So we'll see what this looks like, but after the initial interview is completed and after any settings and settings for contacts have been entered into the system, after that initial interview, those setting records are going to populate here, which is really helpful to be able to reference, and you can also edit them after the initial interview, and that those edits can be made by clicking within this section. Okay, below the patient contact settings section, you can see first at the top, we have highlighted in this red box, the patient contacts section. So this is a section that will show the contact name of the individual that the patient potentially exposed to COVID-19 during the infected period. Again, this patient contact information may have been collected through that initial interview, but patient contacts can also be created outside of that initial interview flow at any time, and all contact records that have been created are going to populate here for easy reference. Again, these records can be edited as well as at any time. Below patient contacts, you can see that we have a section called lab reports, and this is going to include lab report information that has been transferred over from NEDS. You can view it in CTT as you're continuing to conduct investigations, and it is going to be read-only lab report information in CTT. Below lab reports, we have the emails section. This is going to include records of all emails that have been sent to the patients. And we'll go through as we're seeing the initial interview and follow-up flow when those emails are triggered and sent to patients. Below emails, we have the file section. Users are able to upload files, any files that are related to the patient, which is helpful to track any sort of outside documents and keep them in the CTT system. And then below that, we have case comments. This section includes the records of all case comments. And you can see that you can click new to enter a new case comment. This is just a nice way to be able to house any sort of comments that may be helpful for all disease investigators to see or supervisors to see as they're working on this patient. And then below case comments, you can see a case history section. This details any actions or changes that have been taken on this patient, such as the case creation, case owner, or case status change. Okay, looking over to the right-hand side of the case details page, you can see first we have highlighted the calendar. This calendar is view only and shows important dates that are pre-populated based on responses during the initial interview. So in this calendar, you can see 3 color-coded dates. These represent first the date of symptom onset for easy viewing. It also on the calendar shows the date that is days prior to symptom onset. This is helpful for the purposes of talking about potential exposed contacts. And it also shows the date that the initial interview was conducted. Also, on the right-hand side of the case details page, below that calendar, you can see we have a new task section. Users can create a new task if another user in the system should be notified of an action. So let's say that a letter was sent to the individual and the disease investigator wanted to create a task to remind them to do a follow-up potentially quicker than normal, or draw attention to this user for a specific reason outside of the normal process flows, what they can do is go to this new task, enter in a subject line, assign a due date, and then assign it to a disease investigator in the system and click save. So helpful task functionality that's available. Again, this is a Salesforce feature. And then below the new task functionality, you can see an activity section, which just details actions and changes that have been made on the case. Another quick knowledge check, true or false. Users can upload files related to the patient in the contact tracing and tracking system. The answer is true. Users are able to upload files. Great job. Okay, now that we've gone over some Salesforce key features and seen a few important sections on that case details page, we're now going to take a look at the disease investigator user role and go through some of the disease investigator roles and responsibilities. We're going to understand the expected process flows for conducting initial interviews and follow-ups in the CTT system. And we're going to show you how to complete those initial interviews and follow-up flows, giving step-by-step instructions. Another quick look at the user role screen here. Again, if you have the disease investigator role in the CTT system, main responsibilities include performing those initial interviews, completing follow-ups with patients. You're able to adjust a patient's status as needed. Through the interviews and through email sent, you're able to provide patients with helpful instructions and information. And I also just want to call out here that as a disease investigator, you're also able to perform the functions of a contact tracer. But in this webinar, we're only going through the disease investigator and supervisor specific flows. We do have another webinar that is focused on the contact tracer flows. So in order to watch those, please access the other webinar on Train. Looking at the high-level disease investigator journey, you can see over on the left-hand side, we have the disease investigator journey starting. So a typical flow would be that a disease investigator logs in and they access the list view of patients in the system that need an initial interview. They'll know that the patient either needs to begin an initial interview or that initial interview is in progress because the patient will have a status set to assessment in the CTT system. So in order to conduct the initial interview, the disease investigator will call the patient. They conduct that initial interview and perform the contact tracing through the initial interview in CTT. And as this is happening, as the disease investigator is entering information on the contacts created. And then once that initial interview is over, the disease investigator will hang up the phone. They can adjust the patient status to isolation, which will let the system know that that patient has had an initial interview and they're ready to begin the follow-up process. And then once this flow has been completed for a patient, you can see the disease investigator goes back to the beginning, goes back to the list view of patients to begin conducting initial interview with the next patient. In addition to conducting that initial interview flow, disease investigators will also be conducting follow-ups. So we show this through the dotted lines here at the bottom. In order to conduct the correct follow-up flow, the disease investigator will view a list of patients and select a patient with isolation status. Again, this means that the patient has already completed that initial interview and they're ready for a follow-up. So the disease investigator is going to call the patient, conduct the follow-up, hang up the phone, and then move on, view the list of patients to select the next one to conduct a follow-up with. You'll see later in this webinar that instead of conducting a follow-up on the phone, the user is able to initiate a self-service follow-up. So they're able to send an email to a patient, and the patient is able to complete the follow-up questionnaire on their own, which is really great in helping with the workload for the disease investigator, while also increasing citizens' interactions with the contact tracing process. So again, this is just to give you a visual day in the life of the disease investigator. I also want to draw your attention to the home screen that a disease investigator will view upon logging into the CTT system. You'll notice there's a lot of great information on this home screen. So we're going to hone in on a few specific sections that disease investigators should be aware of. You can first see that there is a case initial interview list section at the top, which provides a list view of cases in the system. Within this section, you can see a lot of different hyperlinks, such as the NEDS ID hyperlinks. These can be clicked. For example, if you click on this NEDS ID, it actually takes you to that case detail screen that we were looking at earlier when going through some of those Salesforce features. If you know the patient name or a NEDS ID you're searching for, you can utilize this search bar. It says search this list ... right within this cases section. You can use this search bar to do a quick search for any case. And then over to the right of that, you can see a printable view button. This allows you to print this page in PDF form if needed for any offline records. Below the initial interview list section and the follow-up list section, you can see that we have a section titled Dashboard, the Disease Investigator Dashboard. This is going to display a nice visual breakdown of cases in the system, and you're able to see cases within your jurisdiction. And then over on the right-hand side, you can see a little refresh button. We recommend clicking this button really anytime you log in and you're referencing this dashboard, just to make sure that you're viewing the most up-to-date data in the system. Okay, without further ado, we are now going to show you the steps to complete that initial interview in the CTT system. Again, initial interviews are created with patients who have been brought over to CTT from NEDS. So once their information populates in CTT from NEDS, disease investigators are able to conduct that initial interview. To begin this flow, we start on the home screen. And we would recommend clicking the drop-down button that you see here on the top navigation bar in the CTT system. If you're defaulted to the home screen, it'll say home right here. And when you click the drop-down button, you're able to make a few selections. And as part of the initial interview flow, you'll select cases. I do want to mention you can click a NEDS ID hyperlink from the home screen, as we just saw in a previous slide, but we strongly recommend using this drop-down arrow and selecting cases, because you'll see that when you do click cases, you're taken to a holistic page where you're able to click on different list views for these cases. So you're taken to the cases list view page. Next, you'll see there's another drop down button right next to the list that you're defaulted to when you navigate to this page. What you can do is click this drop down and make sure you select Case Initial Interview List. This will allow you to view all patients requiring the initial interview in your jurisdiction. You may notice that when you click to this screen, it will default to recently viewed. So if you do see recently viewed, you can just click this drop down and make the selection for Case Initial Interview List. Once you are looking at the initial interview list view, you're then able to select a NEDS ID hyperlink from the list. And I want to make sure you're aware, again, that when you're referencing these case options, you can see that one of the columns right next to patient name is status. And notice how all of the statuses in this list view say assessment. That is because the initial interview has not been completed for these patients. So the action required here is to conduct that initial interview. So we're making a correct selection here, and we know that because the status is showing as assessment. So as a disease investigator, you will click on a NEDS ID hyperlink from this list, and that will navigate you to the case details page. We've seen this screen before. What you're going to need to do is click Accept here in the case section to assign the case to you. Again, this makes it so that you are the disease investigator who's working on this case. Once you assign it to yourself, no other disease investigator will be able to view it. I do want to point out, though, that supervisors will be able to view this as they have statewide access. And again, as we saw earlier in this webinar, you're able to click this unassigned button at any time over here on the left-hand corner, that small checkbox, and that will remove the patient from being assigned to only you, and that will trigger the ability for other disease investigators to see this case in their queue if they have the correct jurisdiction for this case. But for the purposes of the initial interview flow, of course, you are going to click Accept to assign the case to you. Again, just a call out, we're on the case details page. You've assigned the case to yourself, and this is really the screen that's going to capture all the work that is completed for this specific patient. Any data that is populated before this initial interview, again, has populated because it's been brought in from NEDS. So what we do now as part of this initial interview process is you're going to be able to reference the patient's phone number here at the top left of the case details page. And you can reference the phone number to be able to call the patient. And to actually start the initial case interview, you click on this initial case interview button within the actions and recommendations section. So again, this is the case details page, but to actually begin that initial case interview flow, you're going to click on this button right here to begin. Once you click on that button, you're taken to the first page of the initial interview, which is the introduction screen. And when you're speaking on the phone with the individual, you can see here on the screen that there's a specific call script. And you can use this call script to have the interview with the patient. On this first screen of the interview, you're going to read the call script and confirm the pre-populated fields and complete blank fields while you're speaking with the patient. I want to point out that in the bottom left-hand corner, you can see this pause button. If for whatever reason the call is interrupted and needs to resume at another time, for example, if the patient needs to end the call and try again later, you're able to click on this pause button to mark this initial interview as in progress. And this will save the initial interview and allow you to resume, pick back where you left off at any time. But again, you read the call script on the screen, confirm pre-populated fields and complete blank fields, and then you'll click next in the bottom right-hand corner once the first page of the interview has been completed to continue the initial interview. This takes you to step 2, which is the symptom screen. Again, you'll read the script, confirm any pre-populated fields and complete blank fields, and then click next once you're done with the second screen. And you can see this is really the flow of the initial interview. You're taken to step 3, the medical history risk factor screen, where you read the script, you confirm the fields, and make sure you are making these selections, and click next. I want to call out that as you're going through this initial interview flow, if you do experience any issues, one good thing to try on your browser is clearing the cache and cookies, and then, trying again. A lot of times that will help with any issues you may be experiencing. So again, we're going through this initial interview, filling out the fields on the screen as you're speaking with the patient. And I know we're not going through these screens field by field, but I do want to make you aware that, again, these slides are available, and there's also an initial case interview quick reference guide available on the resources tab in Train to be able to take a look at these fields. On the initial case interview flow, you'll come to the additional comments screen, where you're able to type in any additional comments about the patient. And then you click next to continue. We can see we're now landed on step 8 of 8, and we are going to go through this in detail because step 8 of 8 of the initial interview flow is where we're able to capture information on patient contact settings and contacts. So this screen is used to collect information on those exposed contacts, both where the exposure took place as well as who was exposed. So again, as you've been doing in the initial interview, you're going to read the call script and then go through the fields that are on the screen. And on this page, we're able to ask questions about the following settings. It could be family, friends, work, school, travel, transportation, events, or any other locations or errands. And we'll show you a specific example here. So as you're scrolling through, let's say that the patient mentions they attended work 3 days before the onset of symptoms. you can see the question, did you happen to attend work? You, the user, are going to click yes, that the patient did attend work 3 days prior to their onset symptom date. When you make that selection that they did attend work, you can see that this Add Work Contact Setting button appears. And you're able to click on Add Work Contact Settings to add all the details about the work setting they are giving you information on. So again, setting in the system really refers to where the exposure took place. So we'll click on this button, and when we do, we see this pop-up screen that appears, and it's titled Patient Contact Settings. Again, this is where we're capturing key information on the work setting itself. This is not the screen where we're capturing information on the contact. We'll get there in a second, but I just wanted to point out this is where we're entering as many details as possible on the work setting. So for this example, let's say that the patient lets you know that they were working at Dairy Queen. They're able to provide you the name of, where they were working. They can provide you a point of contact. This could be a manager or anyone significant. This is not the contact. This is just a point of contact. They can give a phone number and then any kind of details on the work itself. You can capture as much information as possible here on the work setting, and then you click Save. Once you click Save, you'll see we get this nice green banner that says Success, that indicates that the work setting has been added successfully. It will also show you the record, so all the information you captured. And then at the bottom, we can see this Add Contact Record button. This is what we click to actually begin capturing information on that exposed contact. So to add a contact that may have been exposed at this Dairy Queen record, we click on the Add Contact Record button. This is the patient contact screen, and this is the screen that captures all key information for this contact. So you're gonna enter as much detail as you can possibly get from the patient on the contact here on this screen. For our example, let's say they report the contact's name is Lisa Thompson. You can see we've added the phone number, age, relationship to the patient, the date of the exposure, and then you can also see some of those key questions that evaluate the risk of this contact. Were they near this person for 10 minutes or more? Did the patient cough or sneeze on the contact? Were they within 6 feet of the contact? All of that key information is entered here, and then you click Save. Again, once that contact record is saved, we get that nice green success banner to let us know that the contact has been added successfully. Now you can see that when we do add the contact, we're taken back to this Dairy Queen work setting. If there are other contacts that should be added for the Dairy Queen work setting, you can continue to click on this Add Contact Record. So let's say that the patient reports another contact that may have been exposed while working at Dairy Queen. We'll click this button again within the Dairy Queen record. And again, we enter as many details as possible on this contact on the patient contact screen. And then we're going to click Save. Again, we get that nice green success banner to let us know that the second contact was added successfully. I want to point out that you're able to add as many contacts as reported for this specific Dairy Queen work setting record. But once all contacts have been added for Dairy Queen specifically, you can click X to exit out of the work setting. Once you click X, you're navigated back to that initial interview flow, where you're able to keep scrolling and then keep asking questions about different settings. So let's take another example. As we're scrolling down, the last section is called Other Locations or Errands. So after we have asked them about all the different settings above, you can ask them, outside of the events we've already covered, were there any additional locations, such as a doctor's office, a sporting event, music lesson? If they do say yes, you click on the yes radio button here, and then you'll see that the Add Other Location or Errands Contact button populates. So we're able to add these contacts in this setting by clicking on this Add Other Location or Errands Contact button. Once we click that, again, we're brought to the Patient Contact Settings record, where we're able to enter in a new setting record. So this is similar, you saw earlier, we entered Dairy Queen as a work record. Here, let's say that the patient reported that they went to a nail salon. This is where we enter in that setting record. Again, we're not capturing the contacts just yet. We're entering the setting record information, capturing as many details as possible. And then we're going to click Save. We get that nice green success banner that the record has been added. We're able to review the salon setting record that we just created. And then to actually add a contact to this setting record, we click on Add Contact Record. Here we enter as many details as possible on the contact for this specific salon record. And then we click Save. We see that the contact was successfully added. And you can see we're taken back to that salon setting record. If the patient did let you know about any other contacts from this salon experience, of course you could continue adding as many contacts by using this Add Contact Record button. But once all of the contacts for this specific setting record are captured, we're going to click on this X to exit out of the setting. And then of course, once we do that, you can see also the Add Other Location or Errands Contact button has also turned green, letting us know that all of that information was captured. So once all of the settings and contacts for each specific setting have been captured on this screen, we're going to click Finish, the button in the bottom right-hand corner of this initial interview flow. Once we click Finish, we're taken back to the Case Details page, and I want to draw your attention to a few things that have changed. First, you can see here in the middle of the screen that the initial case interview is showing a green icon, or I'm sorry, a blue check mark, just letting us know, okay, the initial interview is completed. One thing that's very important is after the initial interview is completed, you're going to need to click on this Mark Status as Complete button, because this will change the patient's status to isolation. Again, once the initial interview is complete, you want to click Mark Status as Complete and get this patient into isolation status, because that lets the system know that, okay, the initial interview has been completed, and this is a patient that's ready to be part of that daily follow-up process. I also want to draw your attention quickly. Up here, you can see two checkboxes, one for escalated and one for is referred. During the initial interview, you were able to make a selection that whether or not you thought that the patient was complying with their what they need to be doing. If you selected that they are not complying with instructions, then this case is going to check as escalated. And then that lets a supervisor know in the system that they're going to need to take action with this patient. In a similar manner, if you indicated in the initial interview that the patient has any unmet needs that they may need resources for, it will check this is referred box, which indicates to the system that a supervisor needs to follow up with this patient for any resources for unmet needs they may have. So just wanted to draw your attention to that as well. Another thing to know is after that initial interview, you're able to scroll down on this screen and you can actually see the contact settings records that have been created, as well as the contacts that have been created during that initial interview flow. You're also able to see in the files section a case report that's been generated as a PDF, and you can see the email section as well. But again, after completing that initial interview, make sure to click Mark Status as complete to get that patient in isolation status. So this is a screenshot where we have scrolled down on the case details page after that initial interview. And I want to draw your attention that at any time outside of that initial interview flow, a disease investigator is able to create a new setting and add any new contacts to those settings by clicking on this new button in the contact settings section. So if you finish that interview flow, but you do discover that, you know, there was another instance where they went to work or a concert, whatever it may be, at any time outside of that initial interview flow, you can add those records here by clicking New. You can also make an edit to any setting that has already been created. So for example, if a work setting, that Dairy Queen setting that we created, needs to be updated for any reason, we can click on this hyperlink, the setting ID hyperlink here. When you click on the hyperlink, you're taken to the setting page. And again, as we know through our Salesforce features knowledge, we're able to this pencil icon next to any field to make an update, and then we'll click save to make sure that update has been accounted for. And you can also see for this specific setting, which is our, you know, Dairy Queen record, also able to add a new contact at any time for this specific Dairy Queen record. So that can be done using this button here. When we click that button, again, we're taken to the Add New Contact screen where we can enter as many details as possible on a contact that should be added for the Dairy Queen setting record, and then we click Save. You can see here on the setting screen that our record has saved. And I also want to draw your attention. You can see that each contact has a risk level of low, medium, or high. And again, those risk level populate based on information you capture when entering that contact into the system. Just a quick note here at the top, you can see that when we're on this setting record screen, it's in a tab. So what you can do is just click X out of this setting record to return to that patient screen. Just a quick look at the risk assessment. Again, we mentioned that when we're creating contacts and entering that information, such as, has the contact been sneezed on? Were you with the contact for more than 10 minutes? Answering those questions is going to trigger and give a risk assignment to the contact. So if the contact is assigned a high risk, this means that the contact is known to have a direct relationship with the patient because they're living in the same household, they're a caregiver, they may have spent 10 or more minutes with the patient within 6 feet of difference. All that kind of logic is going to assign them a high risk. The contact is assigned medium risk if the contact is known to have physically handed or received anything from a patient. And then the contact could be, or is assigned low risk if we answered, those questions indicating that they were more than 6 feet away from the patient, spent less than 10 minutes with the patient. So again, these slides will be available so you can review this in further detail. Once we exit out of that patient settings record and we're back on the case details page, I also just wanted to show you that as you're scrolling down, you're able to see that any new contacts that are added outside of that initial interview flow, they are still going to populate in this contacts section, and you'll be able to see all of the contact records ever created for this patient in this section. Once the initial interview is complete, you can scroll to this email section to confirm that an email was sent to the patient. Here's just a quick screenshot of what an email could look like that the patient is receiving. Okay, and once the initial interview is complete for this specific patient, once you're done speaking with the patient and all necessary settings and contacts have been added, again, you can click on this X to exit out of this specific case details page. And when you do that, so long as we're on the cases, you're going to be navigated back to the cases list view. And again, this is the list view where we have cases and assessment status, and you're able to click on a NEDS hyperlink that will take you to the next case details page for a specific patient, where you can work on the initial interview for the next patient. Once that initial interview is completed for a patient, I do want to draw your attention. We're not going through the specific step-by-steps that a contact tracer will take, but I do want to let you know how this is working in CTT. So once that initial interview is completed and once those contact records are created in the system, that's going to alert contact tracers to be able to view the contacts that have been created in the system so that they can begin calling those contacts who have been exposed to COVID-19 and providing information to them, conducting, an initial contact interview. So again, important to know that the way this is working in the system is once cases are coming into CTT from NEDS, disease investigators are calling those cases and conducting initial interviews. During that initial interview, they're capturing the contact records. And once those contacts are entered into CTT, the contact tracer is able to see those contacts in CTT, and they're able to begin the contact interviews. Again, disease investigators are also able to view those contacts, and they're able to conduct interviews with contacts if that is part of their responsibility. We really just talked through this, but just to give you the journey of the contact tracer. The contact tracer is going to be able to log in, and they'll view a list view of contacts that need an interview. They'll select a contact in the list. They'll call a contact and conduct that initial interview with the contact. And then they can hang up and go to the next contact to conduct an initial interview. Additionally, contact tracers are also conducting follow-ups with the contacts. So they're able to view a list view of contacts that need daily follow-up. They select a contact, call the contact, and conduct the follow-up. And then they can hang up and move on to the next contact. Quick knowledge check. True or false? Settings are the same as contacts in the system. The answer is false. These are not the same. Settings, again, refer to the place, the location where the exposure occurred. Contacts refer to the individuals that may have been exposed to COVID-19 that the patient is reporting, and contacts can be created for each setting that is created. Another quick knowledge check, true or false? Disease investigators can add multiple contacts for the same setting. The answer is true. Multiple contacts can be added for the same setting. And we saw this in our Dairy Queen example. We added 3 contacts for the setting. We actually added 2 contacts during that initial interview flow. And then outside of the initial interview flow, from the case details page, we added that 3rd contact by clicking new on the settings. For clicking into the Dairy Queen record that had been created, and then clicking new from the Dairy Queen record to add a new contact into that specific setting. Okay, now I'm going to quickly show you how you can create a contact outside of the case details page. So let's say, for example, you've been made aware of a contact who lives in Kentucky, but was exposed from a patient who lives out of state. Of course, we wouldn't be able to create this contact through a case in CTT because that patient is not going to be in CTT. So in a case where, or in a situation where a contact needs to be created outside of that case details page, so outside of that initial interview flow or just not related to a patient at all, what you can do is from this top navigation bar, you click the drop-down arrow, and you're actually going to navigate to patient contacts. So you'll click on the patient contacts button. This is going to take you to the patient contacts list view. And from the contacts list view, in the top right-hand corner, you can click new. And this is going to bring you to a screen where you can enter in as much possible information on a contact. You can see here on the screen, if the user does know the setting that this contact was exposed in, you can create a new setting while creating this contact. This is not required if the setting is unknown, but I did just want to point this out. And then once you have filled out as much information as possible on this contact, you click Save. And this is how you create a contact outside of a case. Okay, now we're going to switch gears and we're going to show you the follow-up flow for a patient. So this is the steps that a disease investigator is able to take to complete a follow-up with a patient in CTT. Let's start from the home screen. From the home screen, you're going to select the drop-down arrow on the top navigation bar, and you're going to click on Cases to view that list view of cases in the system. Here, we're going to use the List View drop-down arrow and make sure that we have clicked Case Follow-Up List. Again, this may default to recently viewed, so you want to click on this drop-down arrow and select the Case Follow-Up List view. This is going to allow you to see all patients requiring follow-ups in your jurisdiction. How do we know that these patients require a follow-up? Again, we can take a quick look at the status column, and here you notice that the statuses are showing as isolation. Again, isolation means that the initial interview has been completed, and at this point the patient requires monitoring. So the action for a disease investigator is to complete daily follow-ups for these patients. So we're going to make sure the patient has a status of isolation, and we're going to make a selection by clicking a NEDS ID hyperlink from the list. When we click on that NEDS ID, we're brought again to the case details page for this specific patient. To start the follow-up flow, you're able to reference the phone number for the patient in this patient details section to give the patient a phone call. And then to start the follow-up questionnaire, you can click Add, this big blue button. Once you click Add, you're able to select Case Follow-up. You'll click on Case Follow-up to begin. I also want to point out that you can confirm a follow-up has not already been completed today by using that History tab that we learned about in the Salesforce features portion of this webinar. So if you want to do a quick check, you can click on History just to confirm that another follow-up hasn't been completed already today. But to start the follow-up flow, you click on this Case Follow-up button. This is going to navigate you to the follow-up questionnaire. And on this screen, while you're speaking with the patient, you're able to confirm all pre-populated fields and complete blank fields on the screen while you're speaking with the patient. I also just want to note again that some information entered on this follow-up screen may trigger a task for a supervisor to follow up with this patient on. So for example, if you indicate that this patient is not complying with their instructions, or that this patient may need resources for unmet needs, it's going to trigger in the system, letting the supervisor know that this patient may need to be contacted by a supervisor. So just something to be aware of, very important to make sure you're capturing information correctly. And once you complete the follow-up questionnaire, you click Next, and then finish to complete the follow-up. Once you click finish, you're navigated back to the case details page for this specific patient. Again, here in the middle of the screen, you can see that the case follow-up has a nice blue arrow icon next to it, letting us know that this has been completed. Again, drawing your attention to the escalated and is referred checkboxes. You'll see these checked if you did indicate that the patient is either not complying or that they need to be referred for resources. You'll see those checked, and again, this is just going to let a supervisor know that they need to follow up with this patient, specifically for the complying or for the resources they need. And then once you've completed that follow-up questionnaire with the patient, you can click X out of the case details page tab here to view the follow-up list view. Now, that is one option to follow up with an individual by calling the patient and completing that follow-up questionnaire. I want to make sure everyone is aware that you're also, instead of doing the follow-up questionnaire in CTT, you're able to initiate a self-service follow-up. So this means instead of actually going through the follow-up questionnaire with the patient, you're able to send the patient a notification via email and have them complete the follow-up questionnaire on their own. If this is the follow-up option you would like to take, I'm going to show you how to do this as well. So again, to view patients who need a follow-up, you're going to click on the drop-down at the top navigation bar, and you're going to select Cases to view the list view. Once you're on the list view, of course, you want to make sure that you click the drop-down and that you're viewing the case follow-up list. If you look at and you see that you it says recently viewed here or any other option, you're not going to be referencing the right data. So you need to click the drop down and make sure you're looking at the cases who require follow-up. And once you are on this list view, you're then able to click the NEDS ID hyperlink for a patient who does require a daily follow-up. When you click on that NEDS ID, you're taken to the case details page. So instead of calling the patient and clicking to begin a follow-up in CTT, you can see over on the right-hand side, we see a section and it says send a reminder via email. What you can do is you can click email and then click next. You'll then get in that section, it'll pop up and say client has been reminded, and you click finish. When you click email next and finish, like we just showed, that's going to trigger the patient to receive an email. You can see the email is similar to the language we have here on the screen. And what's key for you to know is this email is going to contain a hyperlink where the patient is able to click the hyperlink and be navigated to a questionnaire where they're able to complete the follow-up on their own. This is extremely helpful because instead of the disease investigator taking time to complete the follow-up in CTT, having that conversation on the phone with the patient while completing the follow-up questionnaire in CTT, they're able to just initiate this questionnaire by clicking that email reminder, clicking finish, and then letting the patient receive this email and completing that questionnaire on their own. Very, very helpful for the disease investigator. and also great because it helps engage citizens with the contact tracing process. Okay, the next flow I'm going to take you through is how to close a case in CTT. So let's say that you are on a case details page and you know that a patient does not require any more follow-ups. This patient has followed instructions, they've been followed up with the appropriate amount of times. What you can do is close this patient out, and that will let the system know that the patient does not require any more follow-up ongoing. So to do this, the disease investigator is going to navigate to the patient or on the case details page, and over on the right-hand side, the disease investigator clicks closed and then clicks mark status as complete. Once you do this, you will then click select close status to indicate why this patient is being closed out in CTT. You'll be taken to a pop-up screen where you're able to select a closed reason for why you're closing this out. So for example, you can select the patient has recovered and then click done. And you can see in the top right-hand corner, the case details page is now showing as closed. So this means that the patient does not require any further action. And you know that in those list views that we went through, of course, on the follow-up list view, it was showing all cases as isolation status. This patient will no longer show on that list view because they're no longer in isolation status. They're now closed. So again, it is very important that if a case should be closed out in CTT, to make sure their status is showing as closed so that they're not showing up on any incorrect list views in the system. Quick knowledge check. The disease investigator should change the case status from assessment to isolation when A, the disease investigator begins the initial interview with the patient, B, the disease investigator completes the initial interview with the patient, C, the patient has recovered, or D, the patient doesn't answer the phone. The correct answer is that the disease investigator should change the case status from assessment to isolation when they have completed the initial interview with the patient. Okay, we've gone through the initial interview flow and the follow-up flow that a disease investigator takes in CTT. We're now going to show you some specific flows that a supervisor role will take in CTT. It's important to know that a supervisor is able to do the initial interview flow and the follow-up flow that we just went through. And supervisors are also able to do all the functions of a contact tracer. But in this section, we're going to go through what a supervisor is specifically able to do that other user roles are not able to do. So again, a supervisor in CTT refers to the user who's managing teams of other system users and who are completing follow-ups with escalated and or referred patients. They can also complete follow-ups with escalated and or referred contacts. And again, we showed you how a patient can be escalated or referred. We saw that in those check boxes on the case details page after completing the interviews. First, I want to show you what the supervisor home screen is going to look like. It's a bit different than the disease investigator home screen that we saw earlier in this webinar. When a supervisor logs into CTT, they see a dashboard, and this shows a visual breakdown of cases in the system. It's also important to know that supervisors have access to view statewide data. And supervisors are able to view their specific jurisdictions by navigating to the case and contact list views that we've seen by clicking this drop-down arrow, and they can configure their own list views and filter them so they're only focusing on the cases and contacts in areas that they have jurisdiction. Right now, we're going to show you how to complete the escalated and referred follow-up. So as a supervisor, when we're on the home screen, supervisors are going to click on this drop-down arrow and click Cases. Again, this takes us to the case list view. And they're going to select the drop-down next to Recently Viewed and click on the Escalation List View. Supervisors can then click on a NEDS ID to begin the necessary follow-up. Once we click on that NEDS ID, we're of course navigated to the case details page. So you can see that the case is not assigned to this supervisor, but to assign the case to the supervisor so that they are owning this case for the escalation and the referral, what they're going to do is click Change Owner here at the top of the screen. And the supervisor is going to search to find their name and then click Change Owner. That way the case is assigned to the supervisor who is owning the escalation and or referral that needs to occur. The supervisor can confirm that this case has in fact been escalated or referred by again making sure those checkboxes are clicked at the top of the screen. And these checkboxes get clicked, of course, because someone indicated in an interview with this patient that they were either not complying or that they have an unmet need that they may need a resource for. A supervisor can review exactly, what's going on in this patient's situation by reviewing the interviews that have been completed, referencing the comments, and then also referencing any case comments in the case comments section that may have been reported. And then once the supervisor has determined the follow-up reason, they take the appropriate action outside of the CTT system. Once the supervisor has taken action outside of the CTT system on either the escalation need or the referral need, the supervisor should create a case comment in CTT just to record the results of the follow-up and just any notes that may help disease investigators and additional supervisors ongoing as they're working with this patient. And of course, to create a case comment, you navigate to the case comment section and click New. And from here, you're able to enter a comment. You can notate the date, the actions that you as the supervisor took, and the results. And then click Save to save the case comment. Another important instruction for supervisors is how to assign a case to a disease investigator. So we're going to show you the steps to do that now. On the home screen, as a supervisor, you're able to click on the initial interview list to view the list of all cases who need an initial interview from a disease investigator. So we can click here. We're able to select the drop-down arrow and click a specific list view. So for example, you can click on Jefferson County to view all open cases specific to Jefferson County. Once you're in the correct list view, you can see all the different patient records. And over on the far right-hand side, you'll see little drop-down arrows next to each patient. You can select the drop-down arrow and click Change Owner. Once you click Change Owner, this pop-up screen displays and you're able to type in the disease investigator's name who should be assigned to the patient and click Submit. Again, this is based on your office's process and workflows, but if your office is operating in a way where a supervisor should be assigning cases to specific disease investigators, this is how you can do it. And you click Submit. Another option to change an owner is to do it from the case details page. So let's say that you're on a case details page and you need to change the owner. You can see here, the supervisor can click on the Change Owner button. You can search a name for the appropriate user that should be working on this case and then click Submit. Supervisors are also able to change the jurisdictional information on a case details page. And to do this, they're able to, in the case record, click Edit. And this is significant because if you do change the owner of this case to a disease investigator in a specific jurisdiction, you need to make sure that the jurisdiction matches. So you click Edit. You're able to utilize a drop-down to choose a different county and then click Save. We're now going to show everyone on this webinar just a quick look at the executive role. So again, we mentioned this in the top of the webinar, but the executive role is really for leadership in the Department for Public Health to be able to view executive dashboards and conduct analysis through the CTT system. So when an executive logs in, they see this executive dashboard, which shows a breakdown visual of different data in the system. And for executives to view this executive dashboard, very similar flow to what we've seen. They're going to utilize that top navigation bar and click on that drop-down button. They'll select Home and able to view the executive dashboard, where they're able to have this nice visual of statewide data in the system. One other thing I want to bring to your attention before we wrap up, I want to give a spotlight to all the different communications efforts that have been going on for contact tracing. You may be aware, but on the COVID-19 website, there are a handful of communications that are available, and also communications are being posted frequently by the governor and lieutenant governor's social media pages, and communications are being distributed frequently to local health departments. So I just want to encourage everyone on this webinar to look out for those communications, share them, and really help champion the contact tracing effort in Kentucky. Okay, today during this webinar, we have gone through the disease investigator role, showing the flows for how to conduct those initial case interviews and the case follow-up interviews. We've shown you how a supervisor can follow up with any patients that have been escalated and or referred. We've given you a quick look at the executive role. We've shown you detail on Salesforce features that are available in CTT, and we've shown you detail specifically on that case details page where a lot of work is completed for that specific patient. We've also talked to you a little bit about how NEDS and CTT work together. We really appreciate everyone taking the time to view this webinar. Again, I want to make you aware that the slides can be referenced on Train as a PDF. So if there's any particular slide or steps you'd like to read through outside of this recording, please make sure to reference that PDF, as well as the different quick reference guides that are also available on that resources tab in Train. Thank you so much for attending our introduction to the CTT system today, and I hope you have a great rest of your day.